As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my...
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everyone. And Harry, good morning to you. That melodious voice you hear is Harry, our station manager, and want to wish him a happy holiday season. And to all of my guests today, a happy holiday season. And actually to all of our listeners that have listened over the last 4 or 5 or maybe even 6 years. You know, I'm thinking about this show, and with 2022 coming up, the title of this show is Project Access Cares. Project Access Cares for you. And I'm thinking of the gift that we all can give to one another into 2022 and beyond. And the gift of information, the gift of instruction, the gift of just how to kind of navigate through life, I think is that might be more of a material or substantive gift, more than something, well, maybe not more than a Mercedes or Maybach. But Giselle, would you concur that the gift of information is important?
Absolutely, Tom.
Yes. And so my guests today are Giselle Carlotta McDonald, Lauren Kelly, Millie Landock, Jackie Sanchez, and Yuritsa Rodriguez Roman. And we're going to talk about Project Access. And really, this is the people's access. I mean, you got to have a name when you kind of write a grant and get money, and Lauren will tell us about how to identify yourselves and work your brand. But this is a people's movement. Project Access is, so it's the People's Project Access. I'm amending your name, Lauren. You have to, your bylaws kind of make that amendment. Giselle Carlotta McDonald is with us. She's the executive director of Project Access and is actually well, I won't say, well, yeah, you've been there since 2011. I mean, it's important for people to know that this is not a one-off situation for you. You've been able to survive and thrive and be promoted and stay and not get fired. So, congratulations to you.
Thank you, Tom.
And Lauren Kelly is with us. Lauren is Director of Grants and Evaluation. And I mentioned Lauren in the promo that I taped a few days ago, that people often hear maybe once or twice a year from nonprofits in terms of fundraising, but they don't really get a chance to hear about the evidence base and the community benefit and how you guys are evaluated and how you kind of reinvest the people's tax monies into the community for our health and well-being. So really glad to have you join us, Lauren Kelly, Director of Grants and Evaluation. Millie Landock is with us. Millie is the program supervisor, and someone has to supervise folks, right, Millie?
That's right. That's correct.
Make sure they get up in time and get those reports in. And I have joke and kid, but we hear this word accountability so often, but it's so important. Accountability, responsibility, and just the passion to make sure that your mission and purpose is achieved. So Millie Landock is with us, program supervisor, and she's been with, she's also a lead community health worker and case manager. Jackie Sanchez. Jackie, how are you doing this morning?
Well, and yourself?
Good, Jackie, glad to see you. And Jackie's program coordinator at Access Health Connecticut, and she's been promoted. Congratulations on your promotion to lead patient navigator. And last but not least, Yuritsa Rodriguez Roman is with us. Yuritsa, good morning. How are you?
Good morning. I'm doing well, thank you.
Thanks for coming to our rescue at the last minute. And I'm not going to mention the person that is not on the show, but the fact is, to have a team, you got to have backups. You got to have. I mean, we hear about Broadway plays being canceled, COVID. I mean, so many reasons that people might not be available. So to have this constellation of your team, Giselle, is really great to see. And Yuritsa is a bilingual patient navigator and also certified application counselor. And she's also been involved with the REACH program, and we'll talk more about that. But let's maybe kick it off and with the overall, the history of Project Access New Haven, the mission, et cetera. Perhaps Giselle and Lauren, you can help us with that history and early beginnings and talk about the mission.
Well, thank you, Tom. And I know, Lauren, feel free to jump in. We love having the opportunity, Tom. I want to start by thanking you and your team for allowing us to join you this morning. it's always so great for us to, just have a conversation and share with the community and share with, also, not just share with the community, but also thank our partners, like you mentioned. This evolved in the community. Project Access started by providers in the community that were seeing gaps and wanted to do something. And I love the change that you're suggesting for the name, because it really was the founders that cared for the community and wanted to do something. So they form a nonprofit. So we're a local nonprofit in New Haven, and the focus is helping uninsured patients. The core program, which continues to be until this day, even though we have evolved and we have grown, is the core program that supports uninsured patients with specialty care. Our mission, Tom, is to increase access to medical care and services for underserved patients in the greater New Haven area. So as you can imagine, as I say the mission, it reminds me of how much we have gone through with the pandemic. So it has become really critical for us to, really help with the community with access to care and services. And Lauren, feel free to I know we love having, we both Lauren and myself, because we have been at Project Access for so long, like we always think about where we come from and where we are today, which is amazing to see the work, how it has evolved, but also remained the same in some areas.
Yeah, I will just add that, I have been with Project Access since we started, and I really appreciate, Tom, that you mentioned the need to look at outcomes and impact. And I think very early on, we did have a group of physicians who were specialists in the community who wanted to make change around access to care. And in addition to that group, I always have to bring credit to, there was a group of scholars at the time. It was the Robert Wood Johnson Clinical Scholars Program at Yale, but now it's a little bit different. But we have such great resources in the New Haven community, and that group really helped to bring to Project Access that need to think about, how do we collect some data, think about, what we're doing, and how do we document both the need and the impact of the services that we're providing, so that we can go back to our funders and to the community and to the stakeholders and say, we're making a difference, we're helping those who have a need. And so that has been, my role. It's, passion of mine for a long time to really be able to do that with Project Access. And I think we've done a great job over 10 years. In addition to all the services, we've been able to go to conferences and share, the impact and the outcomes from the work that we do, even, publish some papers to let others know, even in other communities, that this is what we're doing and this is how to do something similar.
Indeed. And Lauren and Giselle, before I go to more of the programs and services, and Lauren, you already kind of teased us a little bit with some of the services, but we certainly want to delineate them. But before I move there, tell us about, if you will, the problem that was perceived 10 or so years ago. That problem perhaps was obvious more than 10 years ago. But share with the folks that are just listening for the first time and hearing the word Project Access, what problem was perceived to kind of create for the genesis, for the innovation, for the creativity to kind of institute this initiative?
You want to start, Giselle?
Yeah, sure. So, specifically to New Haven, Tom, what they found is that when it came to access to specialty care for uninsured patients, they found a gap. So, in New Haven, we have a lot of support from the FQHCs, the Federal Qualified Health Clinic, Fairhaven Health Clinic, Cornell Scott Hill Health Center, and also the primary care centers at the hospital. This was, back in the day when we had San Rafael campus, now, campus, then hospital, and also Young New Haven Hospital Primary Care Center. But when it came to access to specialty care, they found that uninsured patients were more likely to delay care because of their insurance. And this was also prior to the Affordable Care Act. So, back in the days, also a lot of patients, that's what in the mission, you see the underserved, because we not only support the uninsured, but also patients that were on a spend down, that they were more likely to delay care. So the gap too that we're trying to address, and we continue to address, is that patients that need that urgent visit, if they're not seen in a timely manner, they're very likely to end up in the emergency department. So we're really trying to get them into the system and get them seen sooner than later.
And Yuritsa and Millie and Jackie, kind of be patient. We're good. I'm coming to you. Don't worry. You'll get a chance to say a few words. But tell us a little bit more about the services and the programs, Lauren and Giselle.
I just wanted to add one thing. I think one thing that's really impressed me about Project Access all along is that we have so many physicians and healthcare providers in the community who were willing to see the underserved and really felt that that was part of what they wanted to do, but we're sort of experiencing their own barriers. So our patient navigation model really helps to make sure that we eliminate, both barriers for the providers and for the patients so that, we can get those patients the care that they need in a timely manner, and avoid things like Giselle's mentioning, like having advanced disease unnecessarily or ending up in the emergency room or admitted to the hospital when that could have been avoided. Do you want to talk about the different programs?
Yeah. Tease folks. This is your. This is not a fundraising thing. We're not going to ask for money at the end or take pledges. However, if people want to make a pledge, they can certainly find you guys online. But yeah, let's share the gift of services and what's available. Because even if someone is saying, "Oh, I'm insured, my family's insured. How does this affect me?" There's no doubt someone in their network, their social sphere of influence, et cetera, that can use this information. So yeah, give us the menu.
Thank you, Tom. So as Lauren mentioned, the core program started with the patient navigator services. And since then, Tom, we have expanded into also having teams of community health workers. So we also have multiple grants from CDC and CMS. One of the reasons why we have multiple team members today is because each one worked in different programs. So we right now have the uninsured specialty care program. As we mentioned, we have the breast health navigation program that also supports patients that are uninsured. And also we have a screening colonoscopy program in partnership with Fairhaven Clinic. And also under the community health worker services, we support patients that have social determinants of health needs. And we provide the same, what we call high touch care coordination, in which we support each patient with their specific needs. So when it comes to community health workers, they focus on helping patients that need access to food, transportation, utilities, financial assistance. So, now with COVID, we've seen a lot of patients that need support with unemployment, a lot of technology early on in the pandemic. So, making sure for those that needed help for their children that, we were providing information like you share. And definitely a lot of what we've done, Tom, throughout, the pandemic too is, because we are building relationship with patients in both patient navigators and the community health workers. And I'm sure, between Jackie, Jaritza, Millie, they have many, many stories to share. And they'll probably do a much better job than me in terms of, what our goal is to be there for all the patients that we serve in the community and providing information. Right now, we're providing a lot of information about what's happening with COVID, the flu vaccine as well, where to go, the clinics. And now that we're getting closer, very close to the holidays too, of, toy drives, also, anything related to the winter weather. So, definitely it's beyond the core programs that we have. The uninsured specialty care, the Accountable Health Communities is one of the grants, and the REACH grant. We also go beyond and just being there for the patients when they have any need for information about resources in the community.
Lauren, would you like to add anything to that?
No, I think Giselle got all the programs. I will mention, I know, Jackie will probably have a chance to talk a little bit about our work with Access Health Connecticut, because that's another partnership that we've had for many years and are currently, really trying to get the word out about open enrollment so that if someone might be eligible for insurance, that, we get that information out and even help them to apply. So that's another initiative.
Although my ego is not so big, although it's relatively large, I know that some people will listen to the show for 55 minutes straight and listen to it five times afterwards and binge on it and share it. But for someone that might have to leave after these first 60 minutes, in terms of accessing information about Project Access, what's the best way for that to for that to come about?
Thank you, Tom. Definitely our website is a great resource for a lot of the things that we're sharing today. So that's at www.pa-nh.org. And also our phone number. We always say, like, please call us if you have a question. If we don't know the answer, we'll make sure to connect you with someone. And that number is 203-773-0838. Again, it's 203-773-0838.
Great, great. Lauren and Millie, are you still there?
I'm here. We're still alive.
So alive and breathing, and you guys can. I mean, some of you have seen me before, and some of you are just seeing me for the first time. So I apologize if I seem too casual, but just see when you say the phrase "still alive," I mean, we're talking about this show is how do we stay alive and healthy and well. In spite of what the political external circumstances might be, and I shouldn't say in spite of, because there's some external circumstances that are impinging on our livelihood. But yeah, staying well is so key. But Millie and Lauren, talk to us about Reach, the Reach your Reach work and partnerships and what you're doing in that regard. Because it's so key for people to know that you're not like working in a silo. You're not being one-off. You're building synergy, if you will. So share with us about how Reach kind of impacts your work and the focus on Lauren.
Do you want me to give some of the history, Millie, and then I'll pass it on? Sure. So yeah, I mean, Reach is a wonderful program. We partner with the Community Alliance for Research and Engagement, or CARE. We've been doing this for a couple years. I think one of the interesting things about Reach is that we started pre-COVID, and we had a model that, we were really excited about. A community health worker would be on site at 2 food pantries in New Haven, Dusk and Loaves and Fishes. So once a week at each location, and actually not just the CHW, we have interns and other Project Access staff there to be kind of a familiar face and to give out information and do some screenings to see if individuals needed more intensive help. And so we did that for a bit pre-COVID, and then that just ended. Obviously, all of a sudden, we were not able to be inside the food pantry because, even those who were going to collect food, are now primarily all outside. So for some time, we were not able to do that at all. We have been able to shift and pivot, quite a bit, and there's some flexibility in our work around Reach, so that for a little while we were actually doing some internal referrals. So those individuals who were in our navigation programs and needed social determinant of help, we were referring to the community health worker. And now, even over the last couple of months, probably more, we have gone back to the food pantries, but now everything is outside. So our community health workers, and we've had interns and other staff members who were there talking to people who were waiting in line and giving resources, both about health, about other resources in the community. Even early on when COVID vaccines became available, we brought a table and a computer, and we're helping people to get scheduled for appointments because we're trying to be where community members are and to offer all the resources and services that we can. And Millie, is really doing the work that community health worker role. So I'll let her kind of share that.
Yeah, I'd just like to add that what I notice is that people, when we're in need, we are open to any type of help that is being offered. People are so open to getting that phone call and so appreciative of getting that phone call and saying, hey, I'm here to offer you resources, and what do you need? What type of resources are you in need of? How can I help you? They're so appreciative of that phone call. And that is one of the things that I love about Reach, being able to not just be out in the community, but also there's a lot of people that are not able to leave their homes because of, you name it. And so that phone call, they're very appreciative. And that's one of the big things that motivates me to come to work daily.
Excellent. We have about 35 minutes, so we have some good time to kind of drill down about stories. I mean, we hear this. I'm thinking of some of the commercials on the fundraising appeals that sometimes get so hokey, or also maybe just appeal to the heart. But you have some real sincere, legitimate life-saving stories that you encounter. I mean, as we speak right now, there's somebody that's alive because of Project Access. I mean, I'll say it. You guys may not want to say it, but I'll say it. And there's more than one person. But Millie and Yuritsa and Jackie, share with us about some of the stories. And you work with clients. You hear this phrase "boots on the ground," but I'll say high heels on the ground, or Crocs on the ground, or whatever that might be the case. But Millie and Yuritsa and Jackie, let's kind of hear from you about some of the specifics of community health workers and what your role is. And really, it's not, people use the term case management, and I hate it. It's in becoming a part of that person's family for that particular point in time, and a helpful part of it. An adopted cousin, an adopted aunt. Millie and Yuritsa and Jackie, let's hear from you. Who would like to go first?
Go ahead, Yuritsa.
I just wanted to, hearing again, it's all of what we do. It is refreshing. And, I would like to say that we are a small team, but we're a mighty team. And with all the programs that were mentioned, we are all cross-trained. So a patient, a community member will never leave our hands without being connected to a resource. Something that I do tell our patients and our community members is sometimes we don't provide the services directly, but we can help you get connected to someone that can and will help you. And we won't hang up the phone or we won't let them leave here, our office space, without a connection, a connection that's going to actually work. Because oftentimes, you'll send a referral, but it's just, there's such a thing as referring someone and making sure that they are connected to the service that they need and that they deserve, or the resource. And, we're really good. I'm really proud to say that we are really, really good here at Project Access with making sure that our consumers, our patients, it's depending the program is depending what our community members are referred to as, and we get to help and support and provide the support not only for our community but for ourselves.
And Yuritsa, do any stories pop into your mind? I mean, we don't have to mention the person's name or the family's name.
So many.
Well, tease us a little bit. We'll
Yeah.
a separate showcase with you, but just
yeah. So when Giselle asked me this morning to join, like a story that immediately popped into my head was prior the Reach Community Health Worker, and that was prior to Meli Katia. She had such a great relationship with just the people in the community at the food pantries, at the soup kitchens, so much so that, she was out for maternity leave and they would call to check in on her. They would call us to check in on her. And, some of the great work that she did during Reach was connect someone who had been homeless for a very long time with affordable housing. But then she went above and beyond and, was able to connect this patient with furniture and just like basic needs and mental health, food resources. It wasn't just, here's your housing voucher, bye. It was, here's a housing voucher or, affordable housing, and also all these resources so that you can be successful, right? And so just things like that. And when patients are able to say, and this gentleman, he was so grateful. He came here and, just talked to everyone and expressed his gratitude for a community health worker and just the program in general. And, I hear this a lot, and I think it's not that we need to thank you, but to hear that we do make a difference. When we call our patients and they say, thank you so much, we appreciate it. Without you, we wouldn't have gotten to where we're at, as far as medically or just as far as basic needs or, things like that. And it's really inspiring, and it's hard work, but it's good work. And
Jackie, just before I come to you, Yaritza, is one more story kind of percolating in your mind as you now you've kind of gotten relaxed and understand how easy this radio thing is?
Like I said, there's so many stories.
Give us one more.
Most recently, like just outside, we do work with breast health navigation, and oftentimes it's hard for someone. It's hard for someone to receive that diagnosis and not have, with all the barriers, language barriers, navigating the healthcare system, not having insurance, dealing with COVID, kids at home, kids not at home, and so our work is we go beyond, right? So we call and navigate these appointments and make sure that they're connected and that the patients are attending. And if they're not, if they need help calling the pharmacy for their meds, we're more than happy to do that as well. But one specific patient just, she was just so grateful. And, anything that I can do for you guys, you let us know. They wanted to bring us food and just only, and I say only because it's just like I feel like we're doing the bare minimum for our community. And to them, it's everything. And, she states that stuff to us, without the assistance, I don't know where we were, where I would be at without your support as a program. I don't know where I would be at. And like I said, it's inspiring because, not to toot our own horn or anything, but, we're really good at what we do because we love what we do.
For sure. And Jackie, just before I come to you, Yaritza, I want to really deeply thank you because the emotional aspect, people forget the world is we want to think that we deal with the rational mind all the time. But it's the emotions that drive us, the positive and negative emotions. So to be able to tap into that and to provide that, you hear this term emotional support, but you do it in a tangible, real loving way. And that's so key. Jackie, I'm not sure if you can talk what Yaritza just was shared, but we'll give you a chance to try it.
No, thank you, Tom. I do have, Yaritza's right. There's so many stories that do pop up into our head, right? And I mean, it's day in, day out, no days the same here. And I've been here with Project Access for 6 years. So stories come back to me in ways that we've helped navigate so many patients, but, a few are, I remember there was one patient who, in the beginning when I was just starting out with navigation and she had issues with her medication. Her issue was that she couldn't read, right? That's a barrier. And she didn't know which one to take in the morning and which one was at night. And it was just a matter, and that having that support at home is big, right? Like how you said, Tom, a lot of times we are their only support. We are their friends. We are the closest things that they have in family because their family is in other countries, right? So, it was a matter of her coming in and literally us sitting there with her and reading the medication bottles and saying, okay, I'm going to put a red sticker for the morning. I'm going to put, a black sticker for night. And that's how you're going to figure out that these are the ones you're going to drink in the morning and these are the ones that you're going to drink at. It was just really having someone there to read that bottle for her and just being able to guide her through that, because it is very overwhelming, especially when you're on your own and then you have these medical issues and you don't know where to go. Recently, like Yaritza said, in regards to the navigation team, the navigators are all bilingual. Recently, we had a patient who he has no phone. He lives with family. He lives with a brother, but the brother works. He doesn't have a phone because he can't afford it. So the way we get in contact with is really through his sister when she's available, right? Because she's working. But he has no transportation, and he has issues in where, little by little, as his health he's had, issues with stomach issues. And then little by little, he's had other issues in regards to, he's seeing a rheumatologist, and he's unable to walk without a walker. So he needs a walker. He was unable, we had to get him to his appointment. We didn't know how to get him there. He has no phone. So we tried to call Metro Taxi, but he needs a phone, because when Metro Taxi calls you to pick you up, they're going to call you. He doesn't have that. So one of our navigators actually met him at the home, called the taxi. When they picked him up, the navigator saw him, stayed with him until the taxi came and picked him up and took him to his appointment. So there's a lot of things that, again, the navigators kind of say, oh, it was just this one little thing that we did. No, it changed the outcome. It changed the life of this one patient and their health, right? A lot of times we don't give ourselves that much credit, because for us, it's just a phone call, but for them, it's much more. Especially when, like I said, we're probably the only support that they've had. They don't have family, parents, right? Because that's another burden. They kind of want to go through it by themselves. And sometimes we're the only or closest thing that they have to talk to.
Definitely, it's extending that lifeline. That's so key. Jackie, just before I ask you about the referral process, et cetera, share with me one more story if you can, because I think both you and Yuritsa have brought to life. This is fundamental. I mean, we can hear these terms: socioeconomic development, health, and inequities, and racism and discrimination. But when the rubber meets the road, many of us don't really understand how blessed some of us are and how not blessed some of us are. So just when you mentioned about the telephone and transportation, just share one other story, because as we move into 22, even doing this show partially saddens me that we have to do a show like this in 2022, that we haven't solved the problem before. But I'm also so inspired by the fact that we have people like yourselves and your teamwork and your network and your passion and your purpose to kind of eliminate some of these problems. But share one more story, if you, in terms of a client.
Sure. So we've had like a breast health patient. She was with us. We're still navigating her. Fortunately, she's now through Husky, but we're still navigating her throughout her treatment. But she actually moved here from, I believe, Chile, if I'm not mistaken. But she came over as a refugee, her and her husband. They came over here fleeing some political issues in their country. When she shortly got here, arrived here, she was diagnosed with breast cancer. And that turned her life around, as well as her husband. They were well established in their country. And then they had to come over here and start all over. And she didn't know where to go, what to do. And she had the support of her husband and her daughter, and they walked her, and they were with her the whole way. And one of the things that I remember when I did her screening was her look, that when she said she was told that she had been diagnosed with cancer, and how she already felt that it was the end of life for her, because she didn't know how they were going to even pay for your care, and to know that, it was going to be a rigorous time in regards to going through treatment. And being able to have a program like Project Access and having a support system to help not only, her, but also be a support for her family, right? Because there were times where she was so weak, she couldn't answer our calls. So, her being able to be there and sometimes just listen to her husband vent and connect them to resources. We were able and also assist them throughout the time until she was able to get Husky. And to this day, she handles her medical appointments, and we're so happy to say that she's in remission from breast cancer. She's in remission. Her family is doing great. And she actually I believe, wrote a book and is on Amazon. And, I think that also her faith really helped her throughout treatment. And she kind of reflects that a lot on her book, her faith in God, and, really having a support system, a strong support system helped her. So even though she has Husky and she handles her appointments very well, she still wants us to stay there and navigate her. So till this day, I think it's been about 3 to 4 years that we've been navigating this particular patient. And it's always refreshing to talk to her and really see, that she's really doing well and that we've made a difference in her life.
And that's everything you mentioned is so key, but just the fact that you mentioned that it's a sustained, you're keeping the connection going.
Right.
So refreshing to hear. We have about 10, 15 minutes, so we're going to talk about how to access the services. Jackie, I'm going to lean on you a little bit, but want anybody else to maybe join in also. And also definitely information about about this open enrollment period. But Giselle, I want to kind of, before I lose this thought, if you had your queen magic wand, if you were queen of the world or king, queen, whatever you wanted to, all these pronouns are kind of confusing me these days, but I won't. Let me not go there. But if you were queen or king, you can take a choice of the world. What do you need to? What do we need to do to eliminate your job?
Thank you for that question, Tom. And one thing that I talk a lot about internally is that when I started our Project Access, there were uninsured patients, and then this was prior to the Affordable Care Act. And then we thought with the Affordable Care Act, there would be no more uninsured patients because now everyone will have an option. And that's not the case in Connecticut. We still have uninsured patients, what we call them uninsurable, that they don't have access to insurance. So I think as I hear my team and I get internally a little bit emotional of, hearing the stories, and there are really so many, is that, we will always be of service and helping and connecting and giving information. I think there will always be a place to help and be a support, emotional support. But Tom, I would love to see a day that there's no more uninsured patients in the state of Connecticut. I know every state is very differently. We know that. But at least in Connecticut, I wish there was a time that I would say that, we moved on to supporting insured patients. And that everyone had access to insurance.
So Jackie, with that, Giselle kind of teed you up. Let's talk about this extended open enrollment period. And even that is still after, what is it, maybe 4 years since we had Obamacare?
9 or like 9 years.
But the word still hasn't gotten out as much as we want. So talk about the open enrollment period, the extension of it, and how people can kind of take advantage of this opportunity.
Definitely. Thank you, Tom. Yeah, so right now we are in open enrollment. So for those who don't know, Access Health CT is the place where you can shop, compare, or enroll in quality healthcare plans. And it's also the place where you can qualify for financial help if eligible in low cost coverage through Husky. So open enrollment started November 1st and it ends on January 15th. But yes, there is an extension. They just extended it on December 15th, they extended it. So when you enroll determines when your healthcare coverage will start. So for coverage starting on January 1st, consumers must complete their application by midnight on December 31st, 2021. For customers who enroll between December 16th and December 31st, 2021, they will have the option to choose whether their coverage will start on January 1st, 2022 or February 1st, 2022. And also for coverage starting on February 1st, applicants have to enroll between December 16th to January 15th, 2022. So, right now is like the best time to really apply and see if you do qualify for health care plans because of all the subsidies that they did do, the COVID-19, American Rescue Plan really helped that situation in regards to really for those who didn't qualify at one point can qualify now. So a lot of people who thought that they were over income or somewhat over income can really get some reasonable deals. We've had consumers who were paying, I don't know if it's kind of really touch upon that, but some consumers who were paying for the same plan, at least I think probably like $50 or $100, were paying $1 something,
like $1.34. Yeah.
Yes, $1.34 for the same plan that they were having before. Nothing's changed. So there's some really great plans. So right now, if people want to compare prices or shop for new healthcare plans, right now is definitely the time. Project Access is one of the 2 navigation sites here. So we have one here in New Haven, and then the other site is in Hartford. We have 4 bilingual certified application specialists. They're all CACs, and we are taking appointments until January 15th. So, if anyone has questions, we are taking questions. If anyone wants to just give us a call and just has questions, or we can set up an appointment, and one of the application specialists can help. Right now, we are seeing in person, also over the phone for those who aren't comfortable with coming into the office. We totally agree. We are taking all the precautions that we have to right now for COVID-19. So we're following the CDC protocol.
And the number again that people can call?
203-773-0838.
Great. We have about 9 or 10 minutes. Let's kind of open it up to everyone and talk about the referral process, because Giselle, when you were sharing with a reach meeting, community outreach meeting last week about the referral process, it can appear to be convoluted, but it seems to me that everyone on your team is kind of like if not a crossing guard, a directional person that you have everyone on the team that can provide kind of these guideposts and these directions to not make to limit the process to be cumbersome. And not that it's the smoothest thing in the world, but there is a distinct referral process. And obviously, when you talk about money and et cetera, and the economy and government, that there's policies in place. But let's talk about the referral process. And Giselle, maybe kick off and then have everyone else kind of share, because even if Giselle says something and Yuritsa, if you disagree about the referral process, let them know, because the referral process, as I understand it, people can kind of interpret it differently, and then given their motivation, where they are in society, where they know English, it could get, so if you understand what I mean, Giselle, kind of start with that, and let's have everyone else kind of share in, and then we can have kind of closing remarks.
Thank you, Tom. And yes, please, anybody from the team. I think, Tom, throughout the years, we have changed a little bit of the referral process just to try to make it easier. But as you mentioned, because there's now multiple ways to, get connected with Project Access, that there's too much information sometimes, and it could be more confusing than actually helpful. So, I do want to mention for the uninsured specialty care program, for all the programs like, Jackie mentioned the breast health, and Jaritza, the screening colonoscopy, and the uninsured specialty care, because we are helping with a gap with access to specialty care, that referral has to come from a provider that identifies the urgency. Right. So it does start from a clinical referral from a provider that refers to us saying, hey, this patient needs to be seen by oncology, and they're uninsured, and they will fill out the demographics. So that form is on our website. We can also, I'm going to try to simplify it, Tom. So like for anybody that is listening in and have questions and want to bring that form to their provider, they can call our office and we will make sure they get that form. Because they can't access it on the website, but we can also fax it to their provider. If the provider is part of, Yale New Haven Hospital, Yale Medicine, or Northeast Medical Group, we can also send the form to them. So that clinical referral form is crucial for us to identify the patients that need that access to specialty care. So I'm gonna stop there, Tom, and see if anybody from the team have any suggestion. But I really want to simplify, because I know it could be, there's so many different options dependent on, that patient. And then for, go ahead.
Just give us a layperson's definition of when you say specialty care. What's the layperson's definition?
Yeah, so when, before specialty would be anything that is not primary care. So, we see everything but dental. Right now, we don't have dental services, chronic conditions, or, I'm missing something, Lauren. I'm thinking
Behavioral
mental,
health.
chronic.
That's, yep.
Behavioral health, we don't cover
Behavioral health.
Mental health,
Thank you,
yeah.
Jackie. Mental health. But everything else, Tom, so if you need to see a cardiologist, dermatology, gynecology, surgery, oncology. So if your primary care doctor, you went to have a checkup and they suggest that you need to be seen by a cardiologist, when they send that referral in, what they can do is send it to Project Access if you're uninsured. And all the services are donated to the patient. So thanks to our partnerships with Yoni Haven Hospital, our providers, like Lauren mentioned, like we have a large network of volunteer providers from private practices to Yoni Haven, Yale Medicine, Northeast Medical Group, and we have all come together to say, like, this is a population that needs timely access to care. So again, that phone number is key. I would say, Tom, like if you have questions, always reach out to us. What I like to say, Tom, is
what's that number again?
Yes, 203-773-0838. And Tom, I just quickly want to mention that, the model identifies that, every patient, we see it that, we peel in that onion to really get to the root of, is it clinical support? Is it social determinants? So, like you mentioned, like all the team works together. So if someone needs access to food or transportation, like Jaritza was saying, like, so I would say, like, call us, and if we don't provide the services directly, if you don't qualify for the uninsured specialty care, we'll make sure that you have connections with the FQHCs, that you know where to go for care. So that number, I would say, Tom, is the best way to get more information.
Perfect. Millie.
Yes.
Let's hear from you. Let's hear from you, dear.
And you want to know about the referral process, right?
Well, the referral process would be good. Any other ins and outs or clues for people? We're kind of winding down, and you've been there for a while, and I won't say that you're the elder statesman of the team, but let's say that well, I won't go there, but share some of your wisdom as program supervisor.
Yeah.
And the referral process.
Yeah, as Giselle mentioned earlier, the referral process for REACH is the approved locations or clinics have to be, are the ones that refer patients to us. But if a patient knows, or if a person knows that they might be able to benefit from our services, they can always reach out to their provider and say, hey, do you think I can be referred to such and such? Right. You could always bring up your concerns to your provider. Your provider will guide you to us. So, and that number again, I have to memorize that number. But that's.
Oh, great. And am I hearing that to be insured is even better than being uninsured? I mean, that's really break it down. Okay. Let me hear from you, Ritza.
So I just wanted to add two things, going back to Access Health. We do offer evening appointments for people that can't get here during the day. And we also offer one Saturday a month appointments just to help meet the needs of the consumers and our community. Additionally, we do have access to translation services. So it doesn't matter, like we have access to any, many languages, not just Spanish. Mm-hmm. And we've had plenty of times, especially within the last few months, patients that do not speak English and do not speak Spanish. And we're able to identify which language it is. And we get on the phone with translation services, and we're able to provide services.
Excellent.
As well.
Excellent. Giselle, team, are you looking for new team members? Are you expanding? I mean, I'm positive that when people hear this show, you're going to get some applicants. I mean, this really sounds exciting. Where are you with your staffing levels? Are you looking for more team members? What's cooking in that regard?
Thank you, Tom. We actually have 2 open positions for bilingual patient navigators under the uninsured specialty care program. I know that Jackie and McClinda Ager, our nurse, have been actively interviewing, so the process, it's active right now. But Tom, like, we do get a lot of questions about volunteers, interns. I know. We have so many great colleges around the area that we have worked with a lot of interns from Southern, from Yale, UNH, Quinnipiac. So definitely, if there's someone that is listening that needs to do an internship in the coming months too, that we're always, could use some extra hands. But for now, we only have those two positions open, Tom, for the patient navigators.
If you volunteer, and who knows what might happen after that.
Exactly.
The way we're winding down, and the way it works is Harry plays the music, and that means we're off. The show is off. So I guess push the envelope. I want to give kind of last words for everyone. Take maybe 30 seconds or so. But what might be on your heart and mind to kind of wish for the community, or wish for yourself, or wish for the universe? Kind of a closing, moving from one season to the next, given this COVID. I'm not even. We could talk just about COVID and people's resistance and hesitance and issues you've encountered there. So I want to salute you right now for dealing with this for the last 2 years, but even before that, you were in the trenches. So Giselle, I'll start with you, and then we'll just go right around the 20 seconds of any last words or thoughts or comments.
Thank you, Tom. Well, first I want to thank you, Tom, because you've been a great partner to the work that we do and, helping the community. And I also want to highlight my team. I definitely, I know you've met Darcy Cobbs-Lomax in the past, and she used to always say, I'm just the director, and I really am just the director. Like Jerisa mentioned, we are a very small team, but we really, everyone has the heart of just helping the community, and it's such a powerful team. So I want to thank them. And our board of directors as well. They're all very passionate in supporting our mission and really doing anything in their power to help us and help the community. So I'm very thankful, and I hope everyone has a wonderful and healthy Merry Christmas and also New Year.
Excellent. And Three Kings Day.
Yeah.
Lauren.
Yeah, that was well said, Giselle. And I'll just add, you mentioned COVID. I don't know if we mentioned our Trusted Messenger campaign. So we've been, since the start of the pandemic, really working hard to just share messages and keep the community abreast of all the the prevention measures and vaccination. And just right now, we all know we're going into probably a tough time, but we are out there, at this point, really pushing, letting people know about the importance of getting vaccinated and staying safe and masking. And so hoping, we're going into the new year and hope that everyone stays healthy and safe.
Excellent. Yeah. You guys, I'll come to the rest of you next show. Let's get to the next show. Happy holidays, Merry Christmas.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road. Let's camera action, I'm ready to